As promised, we're going to take up this interpreting medical images sheet. So you got this last week and I told you just kind of pick at it and do your best on it. So hopefully you did. And again, anything that you didn't get correct, no biggie. That's what we're here to do, is to fix it up. Okay. So first slide looked like this. Now, if you noticed on here, I thought this was kind of neat because it was, you know, one of the first x-rays that was made. It's from January 2nd, 1896. So I just thought it was kind of a neat one to use. So remember, they were using a lot stronger radiation in those days. Probably exposed this hand for quite a while as well. All right, so what type of image is this? Obviously, this is an x-ray, okay? The next question asks you, which hand is this? So if you're looking on the x-ray, you're going to look for the orientation, and you'll see here, it tells you this is the left hand, all right? So next question was, what are the small dots made of? All right, so if you take a look, they sort of have a distinct shape to them, and they are really, really bright white. Okay, so a lot of times people say, oh, calcium deposit. So yeah, it could be a calcium deposit because we said that minerals come up as being quite white, but it kind of seems weird that we'd have these mineral deposits like all scattered all over the place. Now, if you guys remember back to grade 11, or any time you did anatomy, you do know that there's such thing as sesamoid bones, all right? And sesamoid bones are little bones that are going to form in tendons where there tends to be a lot of wear and tear. So if you look here on the thumb, there's a little sesamoid bone in there. When we do another activity later on, you're going to see a foot and it's got sesamoid bones in there as well, okay? But it's kind of odd that we would have all these little wear and tear things here. So because they're so bright white, because they sort of have a distinct shape to them, we would probably guess that they're made out of metal. So if you guess that they're made out of metal, that's great. If you said they were made out of calcium deposits or some mineral deposits, you'd be pretty darn close to it. These are definitely metal. Now the next question is, what do you think it's made out of? What do you think the small dots are made out of? So because we're not in class, I'm sure there's somebody sitting there who knows for sure what the right answer is, and they're kind of too shy to answer. But if you had that the answer was shot, like metal shot from a shotgun, you would be correct. Okay, so this person was shot with a shotgun, and then they used one of the first, you know, x-rays was used to diagnose, or not to diagnose, so to find out where the bone was so they could pick the bones out of the hand. Okay, so good job if you got that. If you didn't get shot from a shotgun, that's fine. It's probably because you don't hunt. All right, so next image. Alrighty, so on this particular picture, we want to know what type of image it is, and if you said ultrasound, you would be correct. All right, what direction is the image? So remember, when you're looking on the pictures here, you're going to look to see where it tells you what what direction it's in. All right, next question is what organ is it pointing to? So again, if you look here, you can see this shape here and then the little dot down here. So this would tell you that it's the gallbladder because it kind of looks that exclamation point mark. Plus on this one's a nice one because they give you the little hint here. And if you remember, the gallbladder sits within the liver. Okay, so that's the gallbladder. It says circle the anomaly. There's actually two here. All right, so we've got one little white spot here and we've got one little white spot here. Okay, so that's one, and the other one doesn't circle, but the other one should be right in there, right? So if you've got one, that's great. If you put in two, that's fine too. All right, and so if you hypothesize what the patient suffers from, right, if we know they've got a little abnormality in the gallbladder, we probably figure it's gallstones. Now, I said to you last time that all the 600-pound life that I watch, and they never seem to have gallbladder problems after losing a whole pile of weight really, really quickly. And then the last episode that was on, they were doing a follow-up. 2 out of 3 people had to have their gallbladders taken out. So I was like, huh, I knew that was one of the side effects of rapid high weight loss. Okay, now if you were looking at this longitudinal image here, where would the head and where would the feet be? So remember, you're cutting, if you're doing longitudinal, you're taking the image from the head to the toes, or in that direction. So if we were looking at this, the head would be on this side, all right, on the left side of the image, and the feet would be on the right side of the image. All right, just next slide just shows you, just to remind you of where the gallbladder sits within the liver. So this would be flipped up, like upright. I just flipped it sideways to let you kind of see how that picture of the ultrasound of the gallbladder came out to be. Like, why is the high part at the top? It's because the gallbladder sits underneath the liver. So this liver would be flipped upright and the gallbladder would be sitting under there, and then you're looking at it in longitudinal direction. Okay, so that's kind of how it nestles there inside the liver. Okay, and there's that exclamation mark sign, a lot better. Okay, so the big body of the gallbladder, and then you've got the portal vein down here, and you got a couple other little vessels in here that sometimes are hard to see. Okay, so there's the main part of your gallbladder. This is all liver, this is skin up there. All right, there's your portal vein. That's the big dot on the exclamation mark that you're going to see. There's the hepatic artery, so the artery that brings blood into the gallbladder, liver, and there's your common bile duct. Okay, there's. All right, so this slide here, first thing is ask you what type of image it is, and if you look here, we've got, looks like bone, and it's surrounded by black. Looks like a magic marker. All right, and in here, if we look at the bone itself, it's not white or off-white, so we know it can't be made with x-rays. So, and because we have so much great detail, we know it must be an MRI. All right, so this is going to be an MRI. Now, which plane is this? So if we're looking at this, it looks like we're looking through sideways, so this is going to be in the sagittal plane. Now this next question says, which part of the body is this? Now this is pretty distinct, okay? You can basically tell this is going to be a spinal cord here. All right, now the spinal cord is going to naturally curve down near the bottom. All right, so this is going to be the lower back. Now name the structure at A. Again, this here is the vertebrate. And in between the vertebrate, we've got the nice the cushion called the disc. Or vertebral disc. Now this already has this problem circled for you, and if you notice here with this disc, all right, it looks like it's flattened. This is nice and big and cushy. It's filled with liquid, you know, it's a nice big water cushiony there. This one's pretty flattened out, and it tends to be bulging out here into, this is the spinal cord. All right, so this is great to be able to see the spinal cord. This one too is bulging out a little bit. So this person is suffering from bulging discs. Now the funny thing with bulging discs is that most people end up having bulging discs. And most people don't even know they have them. And a lot of people who have bulging discs are people who are very athletic and very active. It's, you know, that everybody thinks, you know, it's people who just kind of lie around that have bulging discs. It's more people who are active, and a lot of people don't even feel it. Sometimes some people have a lot of issue with this. What happens a lot of times with the bulging discs is they can bulge for a little while, give you a lot of pain, and then they kind of like ooze back in there for some reason, and they don't cause pain anymore. So that's what a bulging disc looks like. And then if it herniates, if it completely sometimes like pops right open and causes even more pain. Okay, and then here along the back here, I just labeled this so that you can see how white the fat is on an MRI. Okay, so obviously the person was fatter, there'd be a lot more fat out there. So our last one here is going to be, well, it's going to be a CAT scan, but pretending you don't know that it's going to be a CAT scan, you would look at the bones here. The bones are quite white through here. All right, so this is going to be a CAT scan. All right, and in this question is asking you, what plane is this? Well, this is somebody who's been sliced all the way through in the axial direction. So which area of the body is this? Again, we haven't done too much on this yet, but we looked at lungs already that were really, really black on both sides. Okay, it's not a head, because if it was a head, we would have a great big brain in here. We've got these unusual shaped muscles, bones in the back here too. So it can't be, you know, in the top part of our head. Can't be legs, because there's only one of them. Or I guess you could do one leg at a time, but that still doesn't make sense that you would have these bones surrounding the outside and then this one bone in the inside. So the area of the body this is going to be is the upper abdomen. Okay, and the reason you know it's the upper abdomen is because you still have the ribs, all right, around there, and we don't quite see the bowels in here, all right? So if we had that little dummy guy at school, I could just show you better where the cut is at. So this is cut right at the upper abdomen. All right, so name the structure at A. So the structure at A, this unusual irregular shaped bone, is going to be a vertebrate. Okay, the structure at B is going to be a rib. Now the organ at C, now that's that great big organ that sits right underneath your ribs in your upper abdomen. That's going to be the liver. Okay, and then what is the problem? Well, it's kind of nice here because they point the arrows to the problem. So what we have are some dark spots here in the liver. All right, these are probably little cancerous spots that are in there. Okay, but they're pointing out to the dark spots that are in the liver. So the liver, remember we said one of the things to be really good at this, you just have to keep looking at lots and lots and lots of images, and you just get to know what a normal image looks like and get to know if something is out of the normal. So basically what I wanted you to just notice here is if this was normal, this would all be the same color of tissue all the way through. Okay, so I think that should be it for this. Oh, yeah. So this is showing you another CAT scan here of some issues in the liver as well. Okay, some little cirrhosis of the liver. I think that is in here. Okay. So that is the follow-up. So if you got everything perfect on there, fantastic. If you didn't, that's okay too. That's what you're learning. And if what I normally would start this unit off giving you that little, what do I know about imaging? And then we do it before, we do it afterwards, and hopefully you get smarter. But basically, I just want you to get smarter. Okay, so that's it for this video.